A hearty good morning and welcome to a session on IUI, that's intrauterine insemination. We're glad to have Dr. Preethi Ravi among us today to help us understand the topic. Now, IUI stands for intrauterine insemination, and it's also sometimes called as donor insemination, alternate insemination, or artificial insemination. Now, IUI works by putting sperm cells directly into the uterus around the time you're ovulating, helping the sperm get closer to your egg. Now, this helps in fertility and in getting pregnant. This is also one of the most common or commonly used ways to help in the process of fertilization and help in the process of getting pregnant. This is a topic that is specialized by one of our doctors, and she's here to help you understand this better. Doctor, you have the stage.
Thank you. Hello, good morning, everybody. I'm Dr. Preethi. I'm a fertility consultant here in Apollo Clinic, Nagar. I just want to discuss one of the common topics which is used in most of the fertility clinics to help people conceive. So that is IUI. It is called intrauterine insemination. So first, let me define what is intrauterine insemination. Intrauterine insemination is collecting the semen sample from the male partner, processing the semen sample, selecting the healthy sperms, making it more active, making it move faster, making it better to fertilize the egg and change the egg into a baby, and directly injecting the semen sample into the womb, that is the uterus, closer to the place where the egg is getting released. So this helps in the sperm meeting the egg in a better way. We are improving the quality of the sperm so that it is far easier for the sperm to enter inside the egg and turn it into a baby. So to put it in simple terms, we are increasing the quality of the gametes and we are making the gametes, that is the egg and the sperm, come closer to each other so that they can fuse to form a healthy baby. So this is intrauterine insemination. So, first, you should understand what happens in a normal sexual intercourse and what is the physiology behind a normal sexual intercourse and in what way IUI helps in people to conceive. See, in a normal sexual intercourse, when the sperm is getting ejaculated into the female vagina, not all the sperms can enter into the uterus. The mouth of the uterus or the neck of the uterus, the womb, which is called the cervix. So it is like a tight opening. Only few sperms enter into the cervix, go beyond the cervix to reach the inside of the uterine cavity. Why does it happen so? Because the cervix is filled with secretions, thick mucus secretions, which can get thinner at the time of egg release, but still the cervix is filled with secretions. At the same time, for some patients, the angulation between the cervix and the uterine cavity will be so acute. The uterus will be so acutely curved either to the front or to the back that the sperms find it difficult to climb across the cervix and reach the egg. And then for some male patients, the semen sample is filled with many debris. It is filled with sperms which are not healthy, which are not capable of moving very fast. So it usually takes about an hour for the sperms to cross the cervix to reach the uterus and then to meet the egg. So what happens is during a normal sexual intercourse, the uterus, that is the womb, there are some hormone secretions inside the womb. That is some enzyme secretions. These are called prostaglandins, which will make the uterus contract. That is, it will act like a suction pump, and it will make the sperms enter into the uterine cavity because of these contractions. And the inner lining of the womb also has some enzymes which will help in making the sperms move faster, making the sperms stay alive inside the uterine cavity for the entire period till the sperm reaches the egg. So this is what is happening in a normal sexual intercourse. So the female partner also has to secrete some amount of enzymes and hormones which will help in the movement of the sperm. At the same time, the male sperm also has to be strong enough to cross the mucus secretion, to cross the acute angle between the cervix and the uterus, and it should have the energy to stay alive through the entire journey to reach the egg. So, if the gametes are healthy, if the uterus is healthy, if the sperm is healthy, all these happens on its own. That is, during a normal sexual intercourse, the uterus contracts, it pulls up maximum number of sperms inside its cavity, and if the sperm has the capacity to cross the entire uterine cavity, it has the energy stored inside so that it moves actively and reaches the egg because of the chemical attraction between the sperm and the egg. So these are microscopic structures. These are all single celled organisms, that is the egg and the sperm. So, because of the chemical attraction between these two, they naturally find each other, they fuse together, and they form a baby. So, this is what is happening in a normal sexual intercourse. So, why people find it difficult to conceive? Though they feel they are producing healthy eggs, their sperm count is normal, the sperm movement is normal, but still, some people they find it difficult to conceive. What happens is there are some problems, that is with the oocyte quality, that is the sperm attracting capacity of the egg is less because of some inborn genetic mechanisms or because of some other issues like polycystic ovarian syndrome or endometriosis or aging, advanced maternal age. All these conditions can cause some defects in the oocyte quality, which reduces the sperm attracting power. Second thing is, a normal sexual intercourse cannot produce the same enzymes every time. That is the prostaglandin secretion, the enzymes on the inner lining of the uterus, which will help in the movement of the sperm. So, all these things cannot happen in every act of sexual intercourse. That is the second thing. The third thing is, the sperms, though they may appear normal when we examine under a microscope, when it enters inside the uterine cavity, that is the female genital tract, it will not have the capacity to cross the thick mucus secretions, and it will not have the energy to travel all the way to reach the egg. So, these are some microscopic issues which can happen during a sexual intercourse, and that is why conception doesn't happen for some of the couples. So, in what way we are going to overcome these issues? So, IUI helps to overcome all these issues. So, the first thing we are going to do in IUI is we are going to give some tablets, we are going to give some injections to produce one or two healthy eggs. So, when a healthy egg is released, naturally the chemical composition of the egg is good so that the egg can attract a good number of sperms. Second thing is we are going to process the sperm sample, that is the semen sample, so that during sexual intercourse, even if the enzymes are not getting released, even if the uterus is not sucking up this entire semen sample, or if the sperm is not healthy enough to cross the entire uterine cavity, the sample is processed. Good healthy sperms are only selected and some enzymes are added so that the sperms move quickly, and the outer layer of the head of the sperm, it is made thin by the sperm preparation. See, the head of the sperm contains the genetic material. That is the most important part in the entire sperm to help in the egg becoming a baby. So the head is covered by some thick membranes. So these thick membranes are washed out, it is made thin so that the head points out like an arrow, directly injects the egg, and then it turns the egg into a baby. So this is what we are doing it in IUI. So to put in simple terms, we are producing a healthy egg, we are producing a healthy sperm ready for injection into the egg. We are increasing the movement, we are thinning out the membranes, we are increasing the energy of the sperm, and we are placing the egg and the sperm close to each other so that the chemical attraction helps in making both the gametes meet and form a baby. So this is what is IUI. So next is for whom IUI can be done. IUI can be done for patients who have unexplained infertility. That is, Scan shows a proper follicle developing, the egg is getting released, sperm count is normal, but still, because of the biochemical problems, because of unknown microscopic problems, the sperm and the egg, they are not able to meet each other. For those patients, IUI is recommended. Second thing is for patients who are having difficulties in the normal sexual intercourse, that is for couples or for males who have erectile dysfunctions, that is they are not able to produce a proper erection and maintain a normal ejaculation inside the female genital tract. So for such couples, we collect the sperm sample, we process it, and we inject it inside the uterine cavity. The third thing is for third party reproduction. That is, for some couples, when a male count is very less, so they would like to opt for a donor insemination. For those couples, or for in some countries, same sex couples, and for single mothers, for these patients, an artificial insemination can be done. That is third party reproduction. Another thing is a frozen sample IUI. That is for some males who are having conditions like cancer. So for them, there are chances for the sperm count to reduce after the treatment for the cancer, like chemotherapy or radiotherapy or any other surgery for a cancer. The sperm counts are likely to decrease after all these treatments. So for such patients, we collect the sperm sample, we freeze one or two samples, and then once the treatment is over, we use those samples for an IUI. So this is frozen sample IUI. So these are some of the common indications why we do an IUI in our fertility clinic. What all we need for an IUI to be successful? First thing is the fallopian tubes. The fallopian tube should be patent. It should be functional. That is a place where the egg and the sperm meet to form a baby. That is the environment. The fluid inside the fallopian tube helps in the egg meeting the sperm. So this is the place where they both meet. So both the fallopian tubes should be functional. They should be patent. At least one of the tubes should be functional for a IUI cycle to be successful. If the tubes are blocked, then IUI should not be done. Directly a IVF procedure is recommended. Second thing is your ovarian capacity. That is the capacity of your ovary to produce a healthy egg. It should be normal or moderate. If it is very less, in spite of the number of injections you give, the capacity of your ovary to produce a healthy egg will be less, will be poor. The egg will not have the proper sperm attracting capacity. So a normal or a moderate ovarian reserve is needed for a successful IUI. The next thing is sperm count. The sperm count should be normal or a moderate sperm count is again needed, because the sperm, though we are placing it close to the ovary, it has to travel on its own, it has to find the egg on its own, and it has to enter the egg and change the egg into a baby. So both the gametes should be properly functioning to get a healthy baby. We are just placing the gametes close to each other. We are not making them join to form a baby. That is IVF. IUI is just placing healthy gametes closer so that it is easy for them to fuse. So a normal or a moderate sperm count is needed. So these are the three things which is needed for a successful IUI. Next is how we are doing this IUI in our fertility clinic. First important step is sample collection. Sample collection, how we are doing it, when we are supposed to do the sample collection. All these things, each and everything is important for a good, successful outcome. So when are we supposed to do the sample collection? The semen sample collection following a period of abstinence. Previously, it was about 48 to 72 hours, but the latest recommendation says about 24 to 36 hours of abstinence is enough to produce a healthy semen sample. So minimum of 24 to 36 hours to a maximum of 7 days. This is what is the usual recommendation, and that is what we advise our patients also for a healthy sperm sample. Next thing is how we are collecting the sample. The usual routine method is by masturbation. So the male partner masturbates and collects the semen sample into a sterile container. So that is the most commonly used method. But not all males are comfortable with masturbation. Some couples they prefer having a sexual intercourse to produce a healthy semen sample. So in such cases, we have special condoms, sample collection condoms. The normal condom usually has some chemicals which will destroy the sperms. So this sample collection condoms, it will not destroy the sperms. It is just a bag to collect the ejaculated sample, and we can use it for the sperm preparation. More advanced techniques for sample collection will include using some enhancers which will cause penile erection, some oral medications, provided you are not having any contraindications like cardiac failure or severe hypertension, ophthalmic, that is eye problems. All these things you cannot use these medicines. Rest of the patients they can very well use a low dose of enhancer to cause a successful erection and ejaculation. Still, with medicines, if you are not able to produce the sample, you can use a vibrator. A vibrator, it will just cause stimulus to your male organ, and that will cause ejaculation through the penile orifice. So this is the third method. The final method is for some patients with spinal cord injury, birth defects, or following some road traffic accident. They will not be able to ejaculate, they will not be able to have a normal erection on their own. For such patients, we can place some implants. So that is a vibratory device can be directly placed into their spinal cord. So that will cause stimulation of their male organ and cause ejaculation of the semen sample. So these are the usual ways by which we collect a semen sample. The next thing is, when do we do an IUI? What happens to the female partner? So the female partner from the second day or third day of their cycle, they are given some oral tablets, intramuscular injections. So to produce one or two healthy eggs. So exactly the egg should be of a proper size, and then a trigger injection is given for the follicle, that is the shell of the egg, to break and the oocyte to come out from the shell. So this is what is called as ovulation. So the oocyte, that is the female gamete, it develops inside an egg. The egg we call it as follicle. So the follicle has to break so that the female gamete comes out. So this process is called as ovulation. So at the time of ovulation, we do this insemination. Okay. So insemination can be done before ovulation or just before ovulation, a few hours before ovulation, or a few hours after ovulation, or it can be done both the times also, before ovulation or after ovulation. So all these things can be done. Another thing is how we process the semen sample. So once the sample is collected, the sample is made to rest for about half an hour. It is liquefied and then the processing starts. So we put the sample in a centrifuge, all the dead sperms, the debris, everything just gets settled in the bottom. Only healthy sperms are in the top. So the healthy sperms are then collected. A media is added. So what is this media? This media is nothing but it is similar to the secretions of the inner layer of your uterus and the fallopian tube. So when you put the sperm in a similar environment, which is similar to the inner layer of uterus and inner layer of a fallopian tube, naturally the sperms get hypermotilated. The outer layer of the head of the sperm, it becomes thinner. So we are stimulating a natural intrauterine environment to make the sperm more active. We are artificially doing that by producing a similar uterine environment. And then we take those hyperactive sperms, we directly inject it into the uterine cavity close to the fallopian tube. So this is what we do. There are different methods of semen preparation depending upon the count and the motility. For counts which are very low, a simple wash is enough to collect whatever sperms are available. For count which is really good, Then we make the sperms pass through some gradients, that is some ingredients, so that all the weak sperms they get stuck inside. Only the sperms which are healthy, which are capable of really moving very fast, they cross all these and they come out. So we collect those sperms and then we inject. There are many ways of selecting good quality sperms. There are advanced methods like giving magnetic force, and only sperms which enter a particular magnetic field can be selected. There are some enzymatic selection methods. So sperms which are getting attracted to one particular enzyme are selected. So all these are more advanced methods. Usually in IUI it is not done because of the cost factor. IUI is a simple procedure. It is not very costly as an IVF. So sperm selection methods, simpler methods are used to select the sperm. For IVF, these advanced methods are used so that we get very good sperms, which about 10 to 15 sperms are enough. So for such cases, we go for all these advanced sample selection methods. For IUI, simpler methods are enough to get a handful of good healthy sperms. So this is how we do the sample selection. Next is directly the procedure of IUI. So how we are doing the procedure of IUI is, we ask the patient, that is a female partner, to empty her bladder and then ask the patient to lie down. We clean her external genital, the vagina, the outer part of the cervix, that is the mouth of the uterus. All these things we clean with normal saline, that is, it is nothing but a sterile salt water. That's all. So, with that, we just clean all these areas and we use an instrument called a speculum. So, this is called a speculum. So this instrument, it helps in keeping the mouth of the cervix open. So directly we can hold the mouth of the cervix through this instrument. So it is usually a very painless procedure. So we can hold the mouth of the cervix like this, and through this we can pass the IUI catheter directly inside the uterine cavity. So this is how an IUI is usually done. Some centers they do it under ultrasound guidance, especially for patients for whom the cervix is acutely angulated, where you can anticipate some difficulties in placing the semen inside the uterine cavity. You can do this procedure under ultrasound guidance also. Otherwise, it is not a must. You can do it blindly as long as you are confident in keeping the sperms inside the uterine cavity in the proper place. So this is how IUI is done. Next thing is, what are the success rates of IUI and what are the methods by which we can increase the success rates of IUI? Usually IUI has a lesser success rate when compared to IVF. For IVF, we usually say the success rate is about 60 to 70%. But for IUI, for a single cycle, provided you are able to produce a healthy egg, your sperm count is healthy, your tubes are patent, even in spite of having everything normal, the success rate will be around 10 to 15 percentage per cycle. So for couples who are having everything normal, if the first cycle is becoming negative, we usually try again. We go for the second cycle, third cycle, very rarely fourth cycle also. So for such patients, the cumulative success rate, at least for the second cycle, third cycle, some patients conceive. About 30 to 40% of the patients can conceive in about 3 or maximum 4 cycles. This is the cumulative success rate. That is, out of 100 women who are having everything normal, but still because of the microscopic and the biochemical issues, the egg and the sperm, they are not able to meet on their own. So for such patients, for 100 patients, around 30 to 40 can conceive in about 3 cycles or maximum 4 cycles of IUI. So this is the international success rates as well as success rates in our center. So what are the ways in which we can improve the success rates? So there are some techniques, like we can use some injections to produce more than one egg. So 2 eggs or 3 eggs can definitely increase the success rates. At least one of the egg will form a baby. Instead of a natural cycle, naturally if a woman produces one egg, sometimes that might not be enough. So we use some medicines to increase the number of eggs to 2 or maximum 3, not more than that. That is one way. Second way is by doing a double IUI. What is a double IUI? IUI just before the egg rupture, just after the egg rupture, so that we are increasing the number of sperm exposure to the egg. So this is called a double IUI. Third thing is by using recombinant injections for the egg rupture. So what is this recombinant injection? Recombinant injection is an injection which is prepared genetically. Other injections are taken from the other humans. They are purified and they are injected. So that is human made injection. A recombinant injection, it is genetically made. It is prepared in the lab. So usually the potency of this injection will be good. They will be able to produce a more healthy egg which has right hormone compositions, which has the capacity to attract a sperm in a better way. So that is the advantage of using a recombinant injection. Usually for IUI purposes, it is not a must that recombinant injection should be used. A normal human made injection is enough. But for couples for whom already they are having an IUI failure, you are going for the second IUI or a third IUI. For such patients, somehow you have to give them a baby. So you have to increase the quality of the egg. So a recombinant injection is usually preferred in the second cycle or a third cycle of IUI. Next thing is going for a fresh pooled sample. So what is a pooled sample? Sometimes for patients with moderate sperm counts, with moderate motility, a single sample will not be sufficient to produce very healthy sperms that will directly go and meet the egg. To increase the number of sperm concentration, we get two samples. We process both the samples together. We select all the healthy sperms. We join them together, increase the sperm count, and then we put the entire thing inside the uterus. So, this is called a fresh pooled sample IUI. So this is another way. Finally, giving a good support for the baby to attach itself inside the uterus. That is called a luteal support. So following an IUI, we give some medicines. So that will keep the uterus quiet. That will help in the baby which is formed to attach itself inside the uterus and grow properly. So these are some of the ways by which you can have a successful IUI. In case you want to know about the cost of an IUI procedure, it is usually less when compared to a IVF cost. ICSI, it costs about, the entire package costs about 2 lakhs, whereas an IUI procedure costs something around 10 to 15,000 rupees maximum per cycle. So this is the cost of the procedure. So that is why we keep trying 2 times, 3 times, or very rarely 4 times also. So this is the cost difference between the IUI procedure and an ICSI procedure. ICSI procedure, the entire package comes to about 2 to 2.2 lakhs. But an IUI procedure, you can do it in a much lesser rate. The next thing is, what are the common myths following an IUI? So the common myths are, you should be in complete bed rest following an IUI procedure. No, it is not needed. So the gametes, they find each other on their own and a baby is formed on its own. So it is almost like a natural conception. Only thing is we are healthifying the gametes. That's all. We are healthifying the egg. We are healthifying the sperm. We are just helping the gametes to find each other so that they can fuse to form a baby. So it is almost like a natural conception. So you don't need any complete bed rest for this baby. If the baby is healthy, if the formed baby is healthy, it automatically reaches the inner layer of the uterus, it attaches itself and it starts growing. Post procedure, half an hour we ask the patient to lie down. Beyond that, we don't ask the patient to be in bed rest. We ask the patient to carry a normal routine lifestyle. And the next thing is, important myth is, people, they refrain from having a normal sexual intercourse during an IUI cycle. So that is wrong. During an IUI cycle, it is not a must that the patient should be in abstinence. That is, it is not a must that the patient should not have sexual intercourse. They can very well have a normal sexual intercourse also during an IUI cycle. And that can be very close to your ovulation period also, if the male partner is able to give a good sample in frequent intervals, that is in 24 to 36 hours, if the male partner is able to ejaculate and give a good sample, they can very well have a natural sexual intercourse during ovulation, and they can also get an IUI done. So this is the another important myth. You can have sexual intercourse along with IUI. It will only help in increasing the success rates. It will not disturb the formation of a healthy baby. Third thing is, IUI is not artificial conception. Most people think that it is an artificial conception. A sperm is artificially prepared. It is not like that. We are just increasing the health of the gametes, to put in simple terms. We are just increasing the energy of the sperm, and we are increasing the hormone quality of the egg. That's it. Otherwise, they join together on their own and a healthy baby is formed naturally. So it is almost like a natural conception. It is not artificial conception. It is not ICSI. ICSI IVF is what we call test tube baby. So that is an artificial reproductive technique or a assisted reproductive technique. It is not artificial, it is assisted reproductive technique. So there the sperm is taken in a needle, the egg is held in a microscope, and the sperm is directly injected into the egg to form a baby in the lab. And the baby is placed inside the uterus. So this is IVF. IUI is not IVF. IUI is almost like a natural conception. So these are some of the myths usually surrounding an IUI procedure. So when will you move from IUI to ICSI? So that is the most important step in a treatment for a couple with infertility. When are we supposed to shift to IVF from IUI? So for couples with all normal parameters, normal ovulation, reasonably good semen count, both patent tubes, for these couples, we usually recommend about 3 to 4 cycles of IUI, as I said. Still, if the couples they are not able to conceive, female is not able to conceive, still the egg and the sperm they are not able to find each other and they are not able to form a healthy baby. Only for those patients after the third cycle or fourth cycle we go for IVF. But for couples with a little less ovarian reserve or poor sperm counts or with a single tube or partially blocked tubes, it is usually not recommended to waste more time in IUI. It is usually preferred to go to IVF more quickly because obviously that is a treatment method which will give you good success rates. So probably after a single cycle or 2 cycles, for these couples, we directly recommend them an IVF procedure because that will be obviously not wasting any more time and then giving a good treatment which will give a good healthy baby, which will give a good success for the couple. So this is how we usually advise the patients. So if you have any queries regarding IUI, you can post in the comment section or you can have a direct consultation with us in the Apollo Clinic, Anna Nagar, and you can clear your doubts. Thank you.